Hi there.
Hi.
I'm Chris. I'm going to be the nurse practitioner working with you today.
Nice to meet you.
Okay, so it sounds like we're just going to do a general well assessment. So I'm going to start from the head and I'll work my way down to the toes, okay?
Okay.
Sound good?
Yep.
All right.
Great. Let's get started.
Okay. So have you been having any hair loss or itchiness, dandruff, anything like that?
No.
All right, so I'm going to check for any depressions, hematomas, anything like that, hair loss on your head. Okay, looks good. Normocephalic. So then I'll move down to the adnexa of the eyes. I'm looking at the medial canthus and the lateral canthus. Looking for any ciliary injection. Do you have any blurred vision or double vision? No?
No.
Okay. Now you follow my finger with your eyes, keeping your head still. Okay, I'm looking for nystagmus or any kind of palsy or deviation here. Okay. Alrighty. So I'm going to check for a red light reflex here, and it's normal. I'm checking for a corneal light reflex here. And while I'm at it, I'll check that the pupils are equal and reactive to light. And they are. So at this point I'll do a fundoscopy. So just look right over my shoulder here. Okay, and then I'll do the opposite eye. Okay. And then to finish off the eyes, we'll have her read the Snellen chart. So if you can just walk right over here. Okay. So I'll have you cover one eye, and then I'll have you read the top line.
E, F, P, T, O, Z, L, P, E, D.
Okay.
P, E, C, F, D. E, D, F, C, Z, P. F, E, L, O, P, Z, D. D, E, F, P, O, T, E, C. L, E, F, O, D, P, C, T. F, D, P, L, T, C, E, O.
Okay, and then this last line here.
F, C, E, O, L, C, F, T, D.
Okay, thank you. So you are 2013 in that eye, and then we would do the opposite eye, and then we would do both eyes at the same time. So if you can come over here and take a seat again. Okay. So I'll do a whisper test here. And so I'll cover the opposite ear. And can you hear what I'm saying right now?
Yes.
Okay. So we'll do a whisper test. Repeat the numbers after me. 33,
33,
22,
22,
66.
66,
Then we'll do the opposite side. 48,
48,
72,
72,
96.
96.
Okay. At this point, we'll do the Weber test. This is for where we are. So tell me if you hear it stronger on one ear, the other, or both the same.
Both the same.
Okay. And then we'll move to the Rhine test. So tell me when you no longer hear this, okay?
Okay. Okay.
And do you hear it now?
Yes.
Very good.
Okay.
Do you hear it now?
Yes.
Okay, so that's a normal test. At this point, I will look inside the ears here, so I'll have you turn this way. And I'm looking for a normal cone of white. And then there's no bulging or anything along those lines. We look good there. And good here as well. Do you have any tenderness here or there?
No.
Okay, no tenderness. None behind here?
Nope.
Okay. Okay, so actually I'll be looking right into your nostrils here and your nares. Can you take it, breathe through your nose? Breathe through your nose. A little bit congested there. Okay, and that looks normal to me. And that looks good as well. Can you open real wide for me? Alright, so I'm looking for gingival health, any loose teeth or anything along those lines. Go Alright, and I'm looking for any edematous tonsils, uvula being midline, and any pseudomembranes, but everything looks good there. So at this point, I will feel the lymph nodes, feeling preauricular, and they're non-palpable, post-auricular, non-palpable as well. Superficial cervical, submental, submandibular, anterior cervical, and posterior cervical, supraclavicular, and then infraclavicular. Okay, I'm going to feel the carotids here. I'll listen for any bruit, of which there is none. I'm going to do an anterior assessment of the thyroid. Okay, can you swallow for me? And that looks normal bilaterally. I don't see any swelling, and it feels normal to me here. I'm going to check for any spinal step off, and I feel none there either. So I'm going to turn you around here. Okay, can you say 99 for me?
99, 99, 99, 99, 99.
And that's tactile fremitus. So here I'll listen for bronchophony. Please again say 99.
99, 99, 99, 99, 99, 99.
And here I'm listening for egophony. So can you say E?
E.
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 Again.
E. 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 E.
Very good. And I'll just listen to your lungs while I'm at it. Can you take a deep breath in and out for me? Okay. So I'll do percussion posteriorly here. Okay, and I'm going to check for costovertebral angle tenderness. So tell me if this hurts.
Nope. Nope.
And then chest excursion as well. Can you take a deep breath? Okay, and I'm going to have you lean forward for me. I'm going to check for spinal alignment and any presence of scoliosis. And that feels normal. Okay. Alright, so I'm going to have you lay down here for me. Right down there. Yeah, like that. That's perfect. Listening to your lungs here. Can you take a deep breath? Another. Okay, and the lungs are clear, so what I'm looking here is for normal bilateral rise and fall, spontaneous breathing, and at this point I'll do percussion anteriorly. And I'll feel for the point of maximal impulse to make sure that it's of normal lift and not displaced. Okay. I'm going to listen to the heart here, and the aortic, pulmonic, tricuspid, and mitral, as well as Erb's point. And then I'll be checking peripheral pulses, and once again, throughout this I'll be looking at the condition of the skin and looking for any kind of abnormalities during the exam. So I'll feel the pulses bilaterally here, and they're equal. Checking for capillary refill. Looking at the fingers for any alternating nail bed, splinter hemorrhage, or clubbing, of which there is none. And I'll feel for a pulse up here in the brachial region. And can you look that way? I'm looking for any kind of JVD, which I don't see any distension. And then I'll move down to the abdomen here. I'm going to do I'll actually listen first. Okay, and can you bring your knees up? Good. So I'll be doing light and medium palpation at this point. Okay. And then I'm going to feel for the liver. Can you take a deep breath in and out for me? And again. At which point I can measure through percussion. Okay, and it doesn't seem any overly enlarged. At this point, I'll palpate for the spleen. So can you take a deep breath again for me? Good. And again. Okay. And I don't feel any obvious splenomegaly here. And then I'll feel for the aorta here. Okay. And that feels normal as well. Okay. I'll check for the pedal pulses here. And I'm looking for any kind of edema or anything along those lines. Alright, so I will have you stand back up again. And we'll just have you walk back between here and there, and I'm assessing for gait. Any kind of limp, antalgic, Trendelenburg, stamping gait. This appears to be a normal gait here. Okay, and I'll do some range of motion tests here. Can you raise your arms up and back down, across and forward, and then through to your back? Okay, can you just raise and lower your legs? Very good. So now I'll do a bit of a neurological test. I'll have you take a seat again here. Can you tell me your full name?
Ashley Nicole Heilman.
Okay, and you know where you're at?
I'm at my home.
All right, and you know why you're here?
I'm being checked up.
Okay, very good. Can you grab my fingers here? Push towards me, pull towards you. Good. And hold your arms straight out, palms up, and then close your eyes for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Touch the tip of your nose and the tip of your nose. And open your eyes and go back and forth with this hand, touching your nose and your finger. My finger. Very good. Good. And let's do the same with this here. You can set that arm down. And stick your tongue straight out at me. Okay. We'll do this here. Take your leg out. Push towards me, and then pull towards you. Good. We'll do the same here. Push. Towards you. Good. Okay. So, that was a bit of range of motion as well as a little bit of neurological on the lower extremities here. And now I'll move on to deep tendon reflexes. So I'll check the patellar here, which assesses for L4. So just relax as much as you can. Good. Okay. And then I'll check right here for the biceps reflex, which checks for C5, C6. Okay. And again here. Alright, and then the brachiocephalic, which will go right here. And I'm just checking for a little bit of a thumb contraction here, which is also C5, C6. Good. And then I'll move to more of the elbow here, which we'll be checking for the triceps deep tendon reflex, which assesses for C7. Look for a little bit of tricep contraction. And then we'll do the ankle jerk deep tendon reflex, which checks for the S1. Okay, very good. Okay, I believe that wraps everything up. Thank you very much.